Your cat starts hiding. They stop using the litter box. They hiss when you get close. They eat less. They sleep more. They seem different. And most people tell themselves the same thing. Maybe my cat is just stressed. But here is the problem. Stress and illness can look almost exactly the same in cats. And that is what makes this dangerous. Because cats are built to hide pain. They do not want to look weak. They do not want to look vulnerable. So by the time the signs become obvious, something deeper may already be happening. In other words, what looks like anxiety on the surface may actually be pain, sickness, or physical distress underneath. Watch until the end, because the last part is where the real red flags appear. And if you miss those, it can become serious very fast. Part 1. Why cats are so hard to read. One of the biggest reasons cat owners get confused is simple. Cats are masters of concealment. In the wild, showing pain would make them a target. So even inside your home, that instinct is still there. They hide discomfort. They hide weakness. They hide illness. That means a cat can be stressed and sick at the same time, or look stressed when they are actually in pain, or act sick when the trigger started as emotional stress. And that is why behavior changes should never be brushed off too quickly. Because when a cat suddenly becomes different, the real question is not just, what is their mood? The real question is, what is their body trying not to reveal? If your cat has ever changed behavior suddenly, and you later found out something deeper was going on, comment yes below. Part 2. Litter box problems are not always behavioral. This is where a lot of people make the first big mistake. A cat starts peeing outside the litter box, and the owner assumes it is revenge, attitude, or stress. And yes, stress can absolutely do that. A stressed cat may urinate outside the box to mark territory and surround themselves with their own scent because that scent feels safer. But here is the darker truth. That same behavior can also be a sign of pain, especially pain linked to the urinary tract, bladder inflammation, infection, crystals, urinary stones. So what looks like emotional behavior may actually be your cat trying to avoid the pain they associate with the box. They are not being difficult. They may be trying to survive the only way their instincts know how. And that shift in perspective matters, because the wrong interpretation delays the right help. Part 3. Aggression can be fear, but it can also be pain. When a cat becomes suddenly aggressive, people often think the cat is angry. But aggression is not always emotion. Sometimes it is protection. Yes, stress can make a cat lash out. A tense cat may scratch, bite, or growl more easily when they feel overwhelmed. But pain can create the exact same behavior. A cat with arthritis, a hidden injury, internal discomfort, even cognitive decline in older cats. All of these can make touch feel threatening. So, when your cat suddenly becomes reactive, especially when touched, picked up, or approached, do not just ask, "Why is my cat being mean?" Ask, "What hurts when I get too close?" Because sometimes aggression is not a personality problem. It is a pain response wearing the mask of attitude. If your cat has ever become more irritable with age, comment age below. I want to see how many people noticed that shift. Part 4. Not eating is one of the most dangerous signs to ignore. This is one of the most important parts of the video. Stress can absolutely reduce appetite. When stress hormones rise, some cats lose interest in food. So yes, stress can make a cat eat less. But sudden appetite change is also one of the biggest medical red flags in cats, because a cat that stops eating for too long can go downhill fast. And if that lack of eating continues for 24 to 48 hours, the risk becomes much more serious, especially because cats can develop life-threatening liver complications when they stop eating. So this is the line you never want to cross. If your cat refuses food, do not sit back and assume they just need time. A cat skipping meals is not always a mood issue. Sometimes it is the body sounding an alarm. And cats are so quiet with pain that loss of appetite may be one of the only warnings you get. Part 5. Vomiting, diarrhea, hiding, and overgrooming are easy to misread. This is where cat behavior becomes truly deceptive. Stress can upset digestion. So yes, a stressed cat may vomit or have diarrhea. Stress can also make a cat hide more, sleep more, withdraw, even groom excessively to self-soothe. That is what makes this so confusing, because those same signs can also point to medical problems: digestive disease, infection, pain, inflammation, skin irritation, neurological decline, or physical discomfort severe enough that the cat starts shutting down. And this is where tiny details matter. A cat that sleeps curled up and relaxed is very different from a cat lying in a hunched posture. A cat hiding for a little while after a stressful event is very different from a cat that disappears, avoids all contact, and does not improve. A cat grooming to calm down is very different from a cat licking so much that fur disappears and skin breaks open. The behavior may look similar, but the intensity, the pattern, and the duration tell a deeper story. And most people miss that story because they only look at the surface. If you are still watching, comment one below, because this is the point where most owners realize stress and illness are much harder to separate than they thought. Part 6. The red flags that mean you should stop guessing. This is the part every cat owner needs to remember, because there comes a point where you should stop trying to decide if it is stress or sickness on your own. And that point is sooner than most people think. You should get veterinary help right away if your cat shows any of these signs. Not eating for more than 24 to 48 hours. Vomiting or diarrhea that keeps going for more than 24 hours. Clear signs of pain, like limping, squinting, crying out, flinching when touched, or struggling to urinate. Complete withdrawal. No response when you call. Hiding that continues and does not improve. Refusing the litter box for more than a week. Or any serious self-harming behavior. And here is the most important truth in this entire video. Before you assume your cat is just stressed, you have to rule out illness first. Because the line between emotional distress and physical suffering in cats is incredibly thin. And sometimes there is no line at all. Sometimes the stress is caused by the pain. Sometimes the pain is hidden inside the behavior. Sometimes the body speaks first, and the mind just follows. So, if your cat has been acting strange lately, hiding, hissing, peeing outside the box, eating less, sleeping more, or pulling away from you, do not ask only, "Is my cat stressed?" Ask something more important. Could my cat be hurting? Because one of the saddest mistakes cat owners make is this. They think the cat is emotional, difficult, dramatic, or acting out, when in reality, the cat may be doing everything possible to hide suffering. And by the time you can clearly see it, they may have been enduring it for much longer than you realize. That is why any sudden behavior change in a cat deserves respect. Not panic, not assumptions, respect. Because in cats, behavior is often the first symptom, not the last. If your cat has ever shown one of these signs, comment yes below. If you want part 2 on the subtle body language signs that show a cat is in pain, not just stressed, comment part 2. And if this video changed the way you read your cat, let me know in the comments, because that one shift can protect them more than most people realize.